Welcome everyone. Welcome to the Mental Health Prevention Summit Breakout Session 1. This group will be talking about COVID-19, mental health and the impact on Black, Asian and minority ethnic communities. We've got a great selection of panel members to help us with this discussion today. And so I'd like to invite you to familiarise yourself with Teams so that you can also join in. The chat function is on the right-hand side or along the top of your screen. We'll be posting 2 questions on there for you to respond to. So we probably won't have time to respond to all of your questions, comments, responses, but we are recording this session and a write-up of today's event will follow. So we encourage you to share and participate. Finally, just a warning, really, we are all dialing in from different locations. So if we have any technical glitches, we will just carry on and hope for the best. So my name is Chipmini De Silva. I work for South London Maudsley. I'll be your host for the next half an hour. On our panel, we have David Bradley, who is the Chief Executive at South London Maudsley. We have Councillor Janet Campbell, who is a local councillor at Croydon Council. We've got Natalie Creary, who is the Director of Black Thrive, Dr. Shobalade Smith, CBE, she's a Clinical Director at South London Maudsley, and Beverly Wong, who is an expert by experience. So we're going to hear from Beverly first. I'm going to bring you up on screen now, Beverly. There you are, Beverly. Okay, so Beverly has kindly agreed to share some of her recent experiences with us over the next few minutes. Thank you so much, Beverly. I'm handing over to you now.
5 minutes isn't long enough to share what's beginning to surface. But my name's Beverly Wong. I'm a mum with 2 teenage children living in Lambeth under lockdown. I have a long history in the education sector that includes being a parent governor for 10 years at a local school. I've been a family and school liaison officer running parenting workshops, a part-time administrator who in her spare time has also been involved with Parent Power in partnership with King's College and South London Citizens. I'm a community organiser around youth safety, advocating for the parent voice to be in any solutions for our community. As a single mother in lockdown, I care about me and my children. I also care about parents because we're often left just to get on with it. I feel blessed that I have the security of being furloughed from a part-time job and that I live in a 3-bedroom flat where me and my children have space to escape. So I felt able to volunteer with Christian International Peace Services, known as CHIPS, in Brixton to help develop a strategy to support the young people and families that the charity works with. And they wanted to develop something in response to the initial lockdown. While parents welcomed help for their children, they didn't see the need for themselves. And that's a normal response. What we do is we call families weekly to connect, support and signpost them to local help, especially dealing with local authorities, schools around free school meal vouchers, sharing resources. Our volunteers go and call and buy and deliver food for those who are living in isolation or lockdown, or they have no recourse to public funds, they've got low income, struggling on benefit, or they're self-employed with families, as well as we've been giving laptops and Wi-Fi to families to help their children engage in education. Now, 10 weeks in, the stresses and cracks are showing up for me and for them. I listen to families, Caribbean, Black British, African, Arabic, Spanish, Somalian, Muslims, and they are trying to cope with what for them is a real struggle. The snapshot is parents don't feel safe to leave their homes, nor allow their children, and my daughter hasn't left the house in the last month. Parents who are have already vulnerable health conditions feel even more vulnerable with children trapped in the house as they watch lockdown disintegrate with no clear measures in place to secure or protect them. Domestic violence, I've got a parent who's left her partner and taken her only child, and they've gone into isolation. They've got no recourse to funds, no extended networks, and we end up buying them weekly food, and I mean good food. Why? Because she's recovering from cancer. Families are caring for their elderly and their children, and so they're all in it together, feeling vulnerable and stressed, and they're saying to me, I'm just trying to hold it together. Just got to be strong. Special education need parents fighting to get education resources for their children. They're already tired from multi-layered communications, and now they're so burdened. Last night, I spent an hour listening to a mother crying. Her burden in this battle is raw. These families' jobs are frontline. They're in retail, carers, care homes, workers, nurses, cleaners, receptionists, security. At low-paid jobs, they don't have the luxury of working from home. They have to make ends meet, putting their lives and their families' lives at risk. Language is a barrier for some. They don't understand how to navigate the online systems or fill out all them forms. They're stressed by the local authority trying to navigate red tape, council tax benefit. It's all having a detrimental impact on their minds. They can't breathe long enough to handle the situations because they're coming at them. Who do they call for relief? Because our old strategies are not working. Websites, forms. Who's got time for that? Who is really listening? Where do I go? Where do they go when they want to vomit this out?
Beverly, thank you so much. We really appreciate your openness, and we really thank you for the work that you're doing with CHIPS to support those families. It's really kicked off our discussion for today, and you asked some difficult questions there at the end, and I hope, you know, after this event we'll be thinking about our next steps. So thank you so much for starting us off. So you will have seen that our first question has been posted in the Q&A function, and we're starting to see some responses coming through. And while some of those responses are being collated, I want to ask some of our panelists for their thoughts on that first question. So Lade, I'm going to bring you up on screen now. So the question we asked Lade was, what do you think the impact of COVID-19 is going to be on BAME communities and their mental health?
So good afternoon, everyone. I'd just like to thank Beverly for that really powerful statement. And what Beverly's done is highlight something that for me has just become, I always knew about this, but for some people, I think this may be, this time of COVID and with the death of George Floyd in America, it may be that some people are for the first time beginning to understand the very long-standing inequality, inequity and injustice that exists for people of BAME backgrounds in Western countries. And that's not just the UK, but the US as well. I'm a mental health professional. I look after people who are already unwell. And what I see is not people who have suddenly become unwell or, you know, from something that's happened in their adult life. I see people who are suffering because of many years from when they were young because of the trauma of discrimination, and that's racial discrimination, because of the impact of that kind of discrimination on their social well-being and the advantages that they might have, the opportunities that they might have, that mean that they end up in a very socially disadvantaged way. And what that means is that and actually, just I do need to make the point that we talk about BAME as though these are all one group of people, but we are not all one group of people. It's absolutely imperative that people are separated out because it's individuals who are different within their group, and those groups are all different. Someone who is from a Black African background will have a very different experience of growing up in Britain to, say, someone who is from a Black African background who was born in Africa, for example, and the different types of African people, etc. Likewise, the South Asian person who's from if you're an Indian doctor from a middle class background, you'll have a very different experience to someone who's from a Bangladeshi background. But everyone's lumped together, and that in and of itself creates problems anyway. But I think one of the big difficulties is that this is a very long-standing problems. COVID-19 has just highlighted the problems. And what we need to do is we need to accept that there has to be systemic change. That systemic change is complex. It feels overwhelming, but we do have some strategies now that we can put into play that will make a difference. And earlier, Jackie Dyer spoke about the patient and carer race equality framework. That's a mechanism that can start to make some of the differences. It involves the community necessarily. So it means you talking and meeting and everyone working together in the way that Beverly described, reaching out to people in the local community and supporting each other and understanding better what their needs are so that we can design services from the mental health point of view. We can provide care for people in the community and support that's actually going to help them where they need it and with what they need, rather than people like me or in a big organization deciding what people need. Thank you.
Thank you, Lade. Really powerful. Councillor Janet Campbell, I wonder if I can bring you up on screen next and to hear your views on that first question. Handing over to you now.
Hi, I just feel as though I'm repeating what other people have said, but I'm going to say it anyway. Unfortunately, the uncomfortable truth is that COVID-19 has highlighted what the BAME community already know. We know there's socio-economic differences. We know that we dominate frontline services. We know that we are the NHS. We know that we are the backbone of social care and care services, and we know that there are inequalities. What I think COVID really highlighted was our need, and I do see this as an opportunity for us to deliver on this need. The need to be heard, the need for that silence to be broken. And I'd say a BAME person who has gone through any sort of mental health journey knows what that silence is all about. It's the fear of being able to complain, because you don't know what you're in the hands of those who know better. We so desperately need advocates. We desperately need a safe space to talk and to talk about our journey. Talk about our fears, talk about what it is that holds us back from complaining. And we also need courage. There's a need to dispel stigma and awareness and to create awareness. But until you deal with the things that I've talked about first and foremost, it's almost unnatural to have stigma. During my time during the COVID-19 period, I've heard of 2 suicides. I know there's many more, and also there's been arrests, arrests from people with mental health issues, and sometimes going through their first crises.
Thank you. Thank you, Councillor Campbell. I'm just aware of time, and I want to try and get in all of our speakers, if you don't mind. I'm going to invite Natalie Creary next, if you don't mind, Natalie. I'm going to bring you up on screen now, and just to kind of read out some of the comments that were coming through from the Q&A. We've got some people that are really, welcoming what Beverly shared with us at the beginning of this session. And we've got someone that's kind of wanting to draw our attention to what's happening in the US. And, that we really have no time to delay in kind of having some actions. I just wondered if you had any thoughts on on what the impact you think BAME communities are having with coronavirus, and also what you think might be our priorities over the next year to help them.
Okay, so I think the beginning of the session, Gregor Henderson highlighted a range of protective factors that safeguard our mental health, and I think it's also been raised already, but communities from Black, Asian and minority ethnic groups do not have equitable access to these resources or opportunities, and that's due to discrimination and other structural barriers. And I think that's something that we mustn't lose sight of, because I think it's very easy for us to, and it's more comfortable for us to find other explanations for the disparities that we observe, in particular for Black communities in relation to the impact of COVID. I think the inequality was very clear prior to COVID, has been highlighted, but since COVID, I think it's just kind of deepened the inequalities. And I think for lockdown, people experience quite a lot of stressors, and is really kind of characterised by loss, grief and anxiety. And yes, it was difficult for everyone, but in particular for people from Black, Asian and minority ethnic backgrounds, it was even more apparent. So for people who are already trying to manage their mental health condition, you know, they find themselves in a situation where they're at risk of relapse. And for those who were just about managing to cope with the range of stresses that they were experiencing, you know, now find themselves under increased pressure and in need of support from services, and in situations where they don't know where to go, but also they're accessing services that aren't culturally appropriate and therefore don't respond to their needs. So I think that kind of moving forward, we do need to kind of think about the impact of bereavement in particular. That's been a disproportionate impact for people, in particularly from Black backgrounds, but also thinking about, yes, there's the wider determinants, but actually for those of us who are already within the system, you know, the service does need to do things differently in order to deliver better outcomes for people from Black, Asian and minority ethnic groups.
That's really great, because we've had some comments coming through about, you know, having culturally specific services. So that's really spoken to some of those comments that are coming through. So I'm going to move on to the second question, which I believe has been posted onto the Q&A function, which you've touched on there, Natalie, which is, what do you think is the top priority we need to work on together over the next 12 months? So to help BAME communities to manage their mental well-being and to prevent mental ill health due to COVID-19. So we're starting to get some of those responses coming in now. Natalie, I don't know if you want to take that one now that you're on the screen, or
yeah, I might as well. I think the key is that communities are placed at the centre of, you know, whatever it is that we decide to do collectively, so that that's kind of co-produced. But I think that, again, I think it was mentioned before in terms of this work needs to be done in the context of the Advancing Mental Health Equalities agenda, also making use of the patient and carer race equality framework. And I think that there is also something about how does the system, that's the statutory system, the voluntary sector, actually support people from Black backgrounds or from other Asian and minority ethnic backgrounds to actually lead on delivering kind of community-based therapeutic sort of offers within the community, because I think that in particular when you are from a BAME background, actually that having people from your background being able to provide support can be, I suppose you potentially have a better experience, but for those who are not, that they are actually kind of trained in order to be able to deliver culturally appropriate support.
Thanks, Natalie. So I can see that Tony Newman has joined our session, and unfortunately David Bradley has moved on to another session, perhaps. Tony, I don't know if you would like... Oh, you are. I can't see you.
Yeah, hi, good afternoon. I've just ironically come off a call about council funding, but and joined, so I'll continue to listen for
Fair enough, thank you. So David, I'm going to take this opportunity to bring you live. and we are answering the question about the year ahead and what we would like to prioritise. Thank you.
Okay, thanks. And there's been some really good issues raised and responses back from things. I think we are at a bit of a watershed now. We cannot just go back to, we can't go back to how services were before because of infection issues. So we really, and all of the things that we've learned around this. So I think there's a real opportunity now for us to actually change some of the services for the better. We've got this chance where we've kind of got to pause around things and we can redesign and make services that are more appropriate. People have talked a lot about culturally appropriate services, and I think what we've got to do is start to look at how we transfer services out of big organisations to local communities. How do we skill people up, give them some of the skills and the knowledge to be able to provide some services? Don't mean, you know, hospital or things like that, but some of the frontline services. And for example, I know in another part of London they've done a lot of work of transferring skills, training people, black pastors in family therapy techniques that they can then use in communities, and it's a lot more appropriate than saying, well, we'll make a referral up to the Maudsley or somewhere like that. And these are some of the things that I think that we've got to change for. What I think we need to be careful about as well is not, because we will be doing a lot more things digitally. The NHS is moving to a lot of this, and we've got to make sure we don't just reinforce the disadvantages that people have. Someone's raised on here about Wi-Fi. I've had patients and people have spoken and said, we've got no data, so how are we going to be accessing things? So we've got to make sure that we don't disenfranchise people even more with some of the changes that we do on it. So there's all of these things I think are really, really important that we must not lose and make things possibly worse than they were before.
Thanks, David. There is a comment on here about how we will build better links with our community partners, and I wonder if you could have a few comments on that before I hand over to Natalie.
Okay, so there's some of the things around community partners is about, there's a bit of a framework that we've got. We're talking about the PCREF framework, but this is about, I think, engaging with all of our communities and getting these networks together so that we can look at how we transfer these. I can see in some of the comments here around shifting resources to voluntary groups, faith groups. There's a lot of evidence that that works, and I think we've got to actually start to do it. I spoke earlier in the previous session about giving up resources, giving up some of the power and transferring them to groups, and we've got to do that. And what we need to be, I say we need to be held to account by people for this. So we can't hide behind things. It's about getting out there. It's being part of communities, and we've got to do that. You hold us to account to say, well, you haven't done what you said you were doing, and that things are still inequitable. So I think it's about, a lot of this is about accountability and how do we make ourselves there and open, and that you hold us to account and challenge us. It's not comfortable, but we can't be in a comfortable position and change things.
Thank you, David. I'm going to bring Natalie in now because I think you might have some interesting views on that as well, if you wouldn't mind.
Yeah, so I think that absolutely communities need to, as I say, need to be placed at the centre, and we have to have very honest conversations about power and how power plays out in our interactions with services, within teams, and kind of where the decision making lies. And so I would like to see that kind of communities and the voluntary sector having more of a role in shaping those decisions about what is a priority, where resources flow, because I think that's going to be really important, and in particular people who have lived experience needing to be at the forefront of that, I think, definitely. And really thinking about this from a systems perspective. So it's not just about, okay, we've had a few conversations with a few people in the community, but actually what is it that we are doing as commissioners, you know, as people who are writing the policies to actually pay attention to the structural issues, so that in fact that everything we do as a statutory organisation or as a voluntary sector organisation or private sector is that we're actually thinking about it from that perspective, because it's only by doing that will we actually really start to create the conditions where people who historically experience inequalities will be able to thrive.
Thank you, Natalie. I'm going to bring in Lade now. I wonder if you can share a few thoughts before we wrap up.
Yeah, I'm going to say something very quick because I'm mindful that we might want to hear from Beverly, but just to second really vociferously what Natalie just said, and to say that people often think that because it's a complex problem, because it's been going on for such a long time, people think that the solutions therefore are going to be really difficult. Actually, probably it's quite a simple thing about asking questions of yourself at the time that you are delivering a service, setting up a service, at the time that you are, if you are someone who provides services such as a council, a mental health service, a physical health service, you really should be asking yourself, what will it mean for people in my community who are from Black, Asian and minority ethnic backgrounds? It's very simple. What impact will this service have on those groups of people? What are the needs of that group of people? If you don't know, if you find yourself thinking, I don't know, then go out and ask them, and you have to do that in an active way. So first of all, find out the needs of the population. Secondly, if you go and seek that population, find out their needs. Secondly, ask yourself for each of the services that you have, do they work for these individuals? And if not, why not? And then put in place the factors that will help provide the service for that population. In that way, you will bring about some structural change. Anything else that's left after that, then you can start doing research on it, etc. But there are some very basic, simple questions that we just do not ask ourselves as a matter of course. And it goes without saying that in order to do all the above, you have to engage actively with your local community, and that's where the groups like Black Thrive come into play. That's where the work that Beverly's been doing with her group come into play. And Louisa Codjo, who works for us at the Maudsley, has been doing some really good work with local church groups in Peckham and the surrounding area, and she has developed a system by which we can actually actively engage people. It's not rocket science. It's actually fairly straightforward. We just have to do it.
Thanks, Lade, really, really useful. And Beverly, I'm going to bring you up onto the screen now because you started our discussion group, and I'd love for you to end our discussion group as well. And you've been one of those people that have been going out and about and speaking to lots of different communities. And I just wondered if you had any final thoughts before we wrap up today.
It's got to come from community, which everybody's saying. But if we don't have some love and compassion and some practical help, and we can't work together because people want to see results. So I thought, and there are only some stuff, free hotline where people can release their initial struggle in different languages, allocated person or a team to a charity or group so that we can get the supporting those in the community, which helps your learning, and free parent focused counselling for underrepresented parents by underrepresented therapists. I'm not going to talk to you unless it's desperate if I'm talking to you and you haven't got a culture that you can understand where I'm coming from, because I can't talk.
Okay. Beverly, thank you so much. Thank you so much to you and all of our panelists today. We have rapidly run out of time. I am so sorry. I wanted to read out so many more questions, but everything moved so incredibly quickly. As I said earlier in the session, we are recording the session and we will have a write-up of this discussion. In the Q&A function, you will see a link that is posted on there for you to navigate back to a web page that will help you to find yourself back into the main room where we started this discussion. So I'll invite you to rejoin that main link, and a final big thank you to all of our panelists and for you all for joining this discussion. I'm going to end this session now. Thank you.